Hi, I'm Dr. Parinita from Ramaiah Memorial Hospital from the Hospital Infection Control Team. I'm here to talk to you about fungal infections. 18 to 22nd September is celebrated as Antifungal Awareness Week. Over the last few years after the COVID pandemic, there has been a steady increase in fungal infections like mucormycosis, invasive aspergillosis and candidiasis and Candida auris. Candida auris is extremely resistant to most of the commonly available antifungals and very difficult to treat. Most of us during our lifetime are prone to get some or the other fungal infection. The common ones are superficial mycosis, which are caused by dermatophytes and candida. These are difficult to treat because they are resistant to most of the common antifungals available. The systemic mycosis are more common in patients with risk factors like immunocompromised status, uncontrolled diabetes, post-organ transplant or stem cell transplant, or those who are getting chemotherapy. Even hospitalized patients are at risk of systemic mycosis. There have been recent reports of outbreaks of fungal meningitis in the United States and Mexico, and there have also been reports of blastomycosis in paper mill workers. It is important for us to diagnose these fungal infections early so that we may treat them appropriately and there will be no adverse outcomes. There are an array of tests that can be done, point-of-care tests like lateral flow assays, microscopy-based tests, and biomarkers like beta-D-glucan and galactomannan. These give you results within a span of few hours. Culture-based tests also give us quicker results than they used to in the past, and in a couple of days, most pathogenic fungi will grow. Once diagnosed, antifungal susceptibility testing must be done so that we can decide on the appropriate antifungals. Antifungal resistance is on the rise due to inappropriate use of antifungals and antibiotics. In order to prevent fungal infections, we need to use antifungals judiciously, maintain good personal hygiene, hand hygiene, and we also need to take care of the global climate change. Fungal infections have been on the rise due to global climate change. I hope by this all of us will keep in mind that we always must think about fungal infections and take the necessary preventive measures, diagnose them early, treat them appropriately. Thank you.